include the high fructose corn syrup and the fiber.
You want to talk about high fructose corn syrup too? Yeah. Okay, what about fiber? And so we've got a question here, a patient who's 5 days, 6 days post-op.
Yeah.
And she says, what about the Citracil, because it bothers me when I take the Citracil? And the answer to that is, we don't need the Citracil today. We talk about the Citracil and the fiber now because many of my patients are from far away. And because they're far away, this is oftentimes the only time I really get to talk to them. So we talk to you about fiber, not because you need it today, but because I got you today. And then when you go back to Arizona or Idaho or Canada, then I don't get to see you as much as I would like. So fiber is important, not for today, but for the rest of your life. And here are some numbers. The average amount of fiber we're supposed to eat every day is around 32 to 38 grams a day. Now, to put that in perspective, the little tablets of fiber you buy in the grocery store are around 500 milligrams or half a gram. So if you wanted to eat as much as the scientists say we're supposed to eat in fiber every day, you'd have to take somewhere between 64 and 72 fiber tablets a day. That's not going to happen. But what it's telling you is our diet, the way it is today, is grossly low on the amount of fiber we get in. And if you look at some of our medical problems, including obesity and things like that, it may be related to the fact that we have such an abnormal diet, such low amounts of fiber, such highly processed foods, including Bill's favorite, the high fructose corn syrup. So we want you to take fiber in any way you can get it. When you make your choices for food, like bananas and apples and fresh fruits and vegetables and things like that, whole grain foods, always look for fiber. The other thing is that it wouldn't be terribly surprising if fiber was difficult for you now because you're only 5 days after surgery. But think about this, we want you to be taking fiber for the rest of your life. The fiber is good for your health. It helps normalize your bowel function. Of course, everybody kind of knows that about fiber. But the other important things that it does is it helps coat the lining of your stomach and help protect you from ulcers. It helps decrease the absorption of sugars so that you get a less chance of diabetes and stress on the insulin in the pancreatic cells. And so we like fiber. We want you to take as much fiber as you can, but today it's not important. As we talked about, your new life with the MGB is not a sprint, it's a marathon. So all the fiber extra you can get in for the rest of your life, however you do it, is going to be helpful to you. Almost no upper limit to the amount of additional fiber that's good for you in your diet. If you can't stand the Citracil, other things are okay. But we want to advise you to try and eat a healthy diet forever. And that's good, really, this is good advice for all of us. A healthy diet filled with as much fiber as you can get in every single day. And if you don't like the powdered Citracil, there are tablets. If you can't do the Citracil, there is Metamucil and other kind of fibers, and you mentioned the Benefiber. But look everywhere you can for fiber. Nothing's important today. Today, the first week after surgery, like the first day of surgery, is a time of celebration and giving thanks because everything has gone well with every single person from last week. And we're really blessed this morning because we have a lot of post-op patients that once we discharge our patient from last week, we're going to ask them to come up and talk. But we have people from all over the country here this morning who've had surgery and are doing well. We want you to do well, and one of the things for the rest of your life is to be alert, to be aware, to always be trying to add fiber to your diet. That's the way we were designed. We're supposed to have a lot of fiber, and we shouldn't just live on Snickers bars and ice cream and cookies and stuff like that. Eat generally a healthy diet. Now, if you occasionally have something junky, it's okay, but your advice for the rest of your life is really simple and straightforward. Try and eat healthy.
Right. That's easy. It's like I crave, like, grapes and fruit.
Yeah, isn't that wild?
It is.
Yeah, a change in taste.
Mm-hmm.
Yeah. And less hunger?
Oh, yeah. It's weird. It's like I don't feel hungry and I never really feel full, but I know when I'm okay now.
Mm-hmm.
It's like there's something in me that clicks now that says, okay, I'm done.
Stop,
You know?
stop. So say that one more time. There's something inside me that clicks and says I'm done. The name of that is peptide YY. There is something inside you. It does click. It does tell you you're done. And we've discovered the name of it. It's a hormone, and its name is peptide YY. And when we do the bypass and deliver the food down to the lower small bowel more quickly, we throw that switch.
Yeah, it's
And you could feel it.
amazing. I mean, I used to just, I'd eat until I couldn't anymore, you know?
Exactly,
Nothing ever
exactly.
told me he
Because that
stopped
switch
that.
wasn't turning on in you. Right, right. And in part we think, why are so many people getting obese in the United States now? We think in part it's our environment. We're not as active as we were, and we eat different foods. One of the things, one small little thing you can do to get back to the way we used to eat is add more fiber. A healthy diet, looking for fiber all the time. As you know, it's obvious, an apple is a better choice than a Snickers bar. Is it the end of the world now, after your surgery, to have a Snickers bar, to have a cookie? No. Go ahead and have a cookie. Go ahead and have a Snickers bar. But remember, our advice is generally choose a healthy diet.